Hi, today I'm going to discuss a very important topic which is very important to diagnose, important to put your grasp on, and the topic is silent heart attacks. We all know that cardiovascular diseases are the number one cause of mortality across the globe. At any point in time, if we look at the mortality per year in patients with cardiovascular diseases, so there are more than 20 million deaths across the globe every year because of the heart problems. So we need to understand the gravity of the situation, the underlying stigma that cardiovascular diseases pose. We all know that chest pain on exertion is known as angina, and if anginal symptoms get prolonged more than 30 minutes, they can signify underlying heart attack. So if patients have got symptoms of chest pain, have got symptoms of angina, the diagnosis of heart attack becomes very easy on the basis of further EKGs and blood tests, which is known as troponin. So the triad of symptoms, which is chest pain, troponin, which is a blood test, and EKG findings, they can easily diagnose a patient as having a heart attack or unstable angina or acute coronary syndrome. However, there is a particular subset of patients who develop heart attacks silently, which is the most dreadful condition which comes to us as interventional cardiologists. So silent heart attacks, as the word suggests silent, they are not diagnosed because the patient is completely asymptomatic or has symptoms which are unrelated to the heart, like sudden onset weakness, like sudden onset shortness of breath, like sudden onset vertigo, or sudden onset indigestion or loss of consciousness. So these symptoms are not classical angina, but they depict the underlying cardiovascular problem going on, and that is the reason, if not properly picked, the mortality is very high. So in patients who have these atypical symptoms, which are not particularly significantly angina, but angina-like symptoms which appear on exertion, they should always be evaluated in certain subsets of patients, which are number 1, type 2 diabetes, number 2, elderly males and elderly females, and number 3, with patients with comorbid conditions. So these 3 groups of people should always be evaluated for acute coronary syndrome if they have sudden onset symptoms which I've just mentioned. So if you like my channel, if you like the topic, and if you want to know more about heart health, please subscribe the bell icon and watch out for my next videos.